ever seen little squiggles pass through your line of vision? There's a chance they can be floaters, which is no reason for concern, or could be a sign of a serious eye problem. Dr. Jeffrey Whitman of Key-Whitman Eye Center joins us to clear things up about flashes and floaters and what to do about them. Good morning. This is funny. This was last week. I was in the makeup room, and I think I had what you're talking about. I saw this. It was like this thing in my eye. What's a floater?
And I have some in my left eye, so I get them checked once a year. But a floater, well, let's understand a little anatomy. The back of our eye is filled with a clear jelly called the vitreous. Okay. And as we age, it kind of dissolves and breaks up, and little bits of it will pull away from the back of the eye and float around, and you may see dots that look like little bugs, strings, cobwebs, little lines. And that can be normal, or it can be a sign of a problem, but only you can see them, by the way. So don't go over a friend's house and say you see little bugs floating around. They may think you're a little off.
Okay. So who's prone? I mean, obviously, as you age, who is prone to floaters?
Well, you can get it at any age, but typical patient, 50 years of age or older, I qualify, and somebody that maybe has had trauma to the eye, anyone that's very nearsighted tends to get them earlier, and you can even see them after eye surgery.
Okay, so you've explained kind of what they are. Do we need to worry about them?
Well, if you have, and particularly if you have flashes, flashes can be a sign that as the jelly pulls away from the back of the eye, it's stimulating the retina, gives you a false sense of kind of intermittent flashes that can come and go. And, you shouldn't be complacent about sudden onset or new onset, meaning you've had them before, or new onset of floaters and flashes. If you've had a curtain coming down over your vision or a dark area in your vision,
right,
or a loss of vision that doesn't go away, this could be a sign of a hole, tear, or retinal detachment that you need to call us ASAP. This is a medical emergency.
Okay, the thing I talked about was like this little black spot. It was almost like a piece of dirt or something. I was like, what the heck's in my eye?
Yeah.
That's a floater?
That's a floater.
What's a flash?
A flash is that jelly, as it moves around, it impacts the retina at the back of the eye, sends a false visual nerve stimulation of these little electric flashes that you can see in your eye. You can see them better at night. They come and go. But again, flashes, floaters, think emergency call, I need to get an appointment as soon as possible.
Okay, how can a doctor tell if it's serious or not once you get there?
Well, thankfully, our doctors at Key-Whitman are experts in examining the back of the eye, and you'll get a full dilated eye exam. This is one of those times you really need it dilated so we can see all the vitreous and we can see the retina. And if there is a problem, we're going to set up treatment immediately. And we even have a laser for specific floaters. We can actually laser those and get rid of them without surgery.
Wow, it's like so many things. If you take care of it then, it doesn't develop into a larger problem.
So you don't get permanent loss of vision.
So you have 17 locations. Where all do you do the flashes and floaters? Where do you evaluate those?
We do have 10 now.
Oh, I'm sorry.
Okay, no. Maybe but we're on our way to 17.
Okay.
So all our offices, you can get the full exam for the retina and the vitreous. At the Dallas headquarters office, we actually have the laser where we can help dissolve those type of floaters that are usually circular little dots. And the most important thing, again, realize sudden onset flashes, floaters, new onset flashes, floaters can be an emergency. Give us a call right away.
Okay, thanks so much. 10 locations.
10 locations.
If you're having issues with flashes or floaters, you need to call now to schedule an appointment. This is the number to call, 214-220-3937, or visit keywhitman.com to request that appointment.